risk, but some people may not even know they're at risk. A new Gallup poll shows 38% of Americans delayed medical care in 2022. That's up 12% from the year prior. The reason is high price of medical care. Joining us now is Dr. Laurel Soot, Vice President of Medical Management for Providence Health Plan. Good morning to you.
Good morning.
Thank you so much for joining us. So medical costs, yes, they are expensive, but what heart health benefits are covered by insurance?
That's a great question, and something that we really want to emphasize is at Providence Health Plan, as well as many different other health insurance companies, your yearly visit with your physician is the first place to start. And that yearly visit is covered in full by your insurance company, meaning you don't have your deductible, you don't have your copay, and I think a lot of people aren't aware of that.
So are there specific exams that are covered in that yearly visit, or is that just kind of where we start the conversation and see how much it could potentially cost?
No, I think that's a great question too. And what people don't realize, and the analogy I kind of use, is it's like the dentist. When you go to the dentist, sometimes they'll tell you you have a cavity and you're unaware. This is the same thing. When you go to your doctor, they're looking for many different things. They're looking for the risk factors for heart disease, which is smoking, obesity, diabetes, hypertension, what's your cholesterol level. So in doing all of that testing, which is completely covered, the initial testing, which is checking lab work, checking your blood pressure, heart rate, your weight, all of those things are covered by the health insurance. And that's the first place to start to see if you have a risk factor for heart disease.
So if we are going to our yearly exam, at what age should we be having a more serious conversation with our doctor about heart-related health?
I think it's very early. It's actually much earlier than people realize. So starting at the age of 20, you should be having your blood pressure. You should be looking to see for signs of type 2 diabetes, and also a family history is really important. If there's any men in your family that have had heart disease under the age of 55 and women under the age of 65, that can really trigger your physician to look for additional risk factors and things that we can impact in a positive way, meaning that we can prevent heart disease. And I think many people aren't aware of that.
Yeah, that 20, that surprises me. That is so young. Is there anything that we can be doing to better take care of our hearts?
Yes. There's actually several things. And I think that's the other thing is that people don't realize that many risk factors really can be significantly decreased. Obviously, stopping smoking, really looking at physical activity and health in the sense of what is your current weight, what is your blood pressure. Those two things are really related. Same thing with your cholesterol levels. What's your physical activity? And then there are many different things I think people are unaware that health insurance can help with in regards to that. So a lot of plans will have a fitness benefit. Some even have ways to help people obtain a healthy food if that is something that they're having food insecurities. So there's a lot of different options out there outside of, somebody would think just taking a pill or taking medicine.
Dr. Soot, thank you so much for joining us and for those great tips. Appreciate your time.